time she's ever been stuck with needles. But you know, she's 12 and a half. So I treat her about weekly with acupuncture because I can, because you know, she's at home. And I do have her on a variety of herbs, and I've really noticed a difference in the last year since we started this. That she's really improved in mobility and, you know, just, you know, her general energy level that's often waning in, I know, we're getting ready, in our older dogs. So I'm going to treat her with some of the points that I typically use for her. Like Kristen said, we often do this point on the top of the head called governing vessel 20, just because it's a really good calming point. So it's often the first one I put in, just because, you know, when they're more relaxed, they're not moving, it's a lot easier to then get the other needles that are important in from there. So it's kind of good. And so yeah, see, she didn't even fall. You know? Okay. Can I have another, please? Trees. And there's another one back here, right where the sacrum and lumbar spine connect, called byway. Another very common point, so very commonly used. It's also good for her because she is older, so she's got kind of that back end weakness, her legs, back legs. And she doesn't like to do the third floor walk up anymore. She likes to go in an elevator building. Okay. And see, look, she's sitting here completely fine. Like I said, she's used to this, but you know, this is not untypical. I mean, I do find the first treatment, they tend to be kind of like, whoa, what are we doing? And they've got the sights and sounds of the animal hospital around them, so they tend to be a little bit on edge. But once they calm down and relax, you know, the second or third treatment, they just kind of like, I have one dog that brings his own bed, and he kind of comes and hangs out, and he gets his acupuncture every other week, and he is just totally happy. So like I said, her back legs are kind of weak. She's also in Chinese medicine. She's in the water phase of her life, her old age. So her kidneys are important to support. So there's a point, the kidney association point along the back is right back here. So we'll put some needles in there. Sometimes she gives a little zing with this one. Let's see. Yeah, okay. See, look, there's a little twitching. That's good. Chi flowing. But then it doesn't hurt her. She's not trying to rip them out. You know, I'm sure it feels a little tingly, but she's okay. She's just going to fall asleep, take a little nap while we're here. The other thing I treat her for is she does have seizures. So we often do a couple seizure points. The calming points are very important for that. Kristen mentioned the point in the tail is also very good for seizures. It draws the excess energy from the head to the tail, dissipates that, so that's very good. Yeah. Other points that are very good, if the pet will let you, you know, often we can get access to the back. You know, they're lying down, they're sitting up, it's very easy. A lot of dogs don't mind you touching them around here. Now the paws, there's not necessarily every dog's going to let you do that, but if they will, there's some very powerful points in the paws and the front hands that go up to the head. So again, seizures, or if you ever think that dog's got like dental pain, has headaches, is a very powerful point on the paw. I know. And again, not every pet will let you even touch their feet, much less put needles in their feet. But oh well. And I'm using fairly long needles, just because that's what I have here today. But the needles do come in different lengths and sizes. I mean, they're all very thin. You can barely probably see that from far away. But there are some really tiny needles. I have one dog that I'm treating for another neurologic condition. She's just super sensitive to everything. I use these like itty bitty little Korean hand needles because she won't tolerate anything else. But so it kind of depends on the dog or size or cat. There are some cat issues.
Does that mean it goes less deep? when it's shorter.
Yeah, and in some ways that initial kind of grasp is going to be a little bit less because you've got a smaller needle in there, but it still works. You're still activating those nerves, maybe not as strongly. And in this dog, that's kind of okay because she's got a lot going on. So you don't want to overdo it. There's good ones. So those are that we kind of guide. I have some pets that you just really need to use the smaller needles, even if like you think they could tolerate the bigger ones. But it really kind of depends. So I usually stock a variety of sizes because of that.
Usually like in older dogs, I like to go a little bit smaller than maybe a dog half their age would be able to tolerate, just because I don't want to overstimulate them.
Right.
Sometimes I use the shorter needles just because of like physics. If like I have a point right here and the dog is walking around, if I put a long needle in that's kind of top heavy, it tends to fall out a little bit more easily, especially when just kind of gives a little shake. A shorter needle, just stays in a little bit better.
What point is that? So this is bladder 11, which in Chinese medicine is associated with bones. So I use it commonly in older pets who have arthritis, and she does have arthritis in addition to other things. And so she often, when I will treat her. I also know that from X-rays, because again, this is not used isolated necessarily. She has a little bit of a calcified disc in her lower thoracic spine, so I think that's contributing to some of her highlights. So I will, with caution, don't use electroacupuncture in a lot of neuro patients, but this is my dog, so I'm a little bit okay with it. So I would connect like this point and that point because I know that I'm bridging that area where she may be experiencing a little bit of tightness because we know that the disc is right in this area. And that really helps with pain relief. So like when we have those back dogs, those dachshunds that throw out their backs, the electroacupuncture is very, very good. I typically personally don't use electro the first visit, no matter what, just because you gotta get a read of the dog. They need to sit still, and again, they tend to be a little bit more anxious day one. So that's something that often I'll incorporate on the second or third visit if it seems like it's appropriate. She can barely keep her eyes open.
How old is she?
She's 12 and a half. And then this is right by the shin bone here, is that stomach 36. It's good for digestion. Obviously from the stomach you expect that, but it's really just a good, in Chinese medicine, considered a qi tonic point. So any kind of deficient animal who's like experiencing weakness in strength and appetite and energy, it's a really good point to use.
I basically use that point for every animal.
I think every pet gets like byway, GV20, and like stomach 36 if they'll let me. Just because that combination is good for so many different things.
So remember Dr. Lesser said earlier, we don't have the needle at home, even just pressing or massage the point would also have some of that.
And I'll do some, we talked about electroacupuncture. In some pets, I will also do aqua acupuncture. So if there's a point that you feel like needs more than that, just 20 minutes of stimulation, but maybe they're not the right candidate for electroacupuncture, or again, time sometimes just gets away from you in the hospital, I will do a small injection of B12 typically, but sometimes just saline, and just put that right under the skin, and it just gives you a little sort of extended releasing. That can be very helpful. And B12 is a great little energy tonic anyway, so it's helpful in many ways.
Sweet.
Yeah.
That's the response she always has, right?
Yeah, this lasts about 20-30 minutes, and then she's like, I'm done. And then she'll get up and walk around and like kick the needles out.
Oh, wow.
But she, and that's something I also say to people, it's like, don't get frustrated too if you show up for acupuncture and like half the needles fall out in the first 10 minutes. I'm like, well, they're done with them. They had their effect. They did what they needed to do, and your pet has now decided that they're done, and that's okay too. It doesn't have to be an hour. It can be 10 minutes. Even just getting the needle through the skin, even if it doesn't stay there, is better than not having done anything at all. You're still getting some of those effects. You're stimulating those nerves, so you're getting that energy flow.
You want those muscles to relax, and so when it's wound around, as the muscles relax, it's not going to be as grippy on the See, none of my patients are like this, all of my patients